Right now, there's lots of good evidence and studies that have been done into this that ultimately prove that daily sunscreen use does reduce the number of skin cancers. And they've compared people for up to 4 or 5 years with one group all using sunscreen every day and one group told to do whatever they like. And there's been significant reduction in skin cancer in the group that has been using sunscreen. So there certainly is a big improvement in using sunscreen. There's no debate about that. So a lot of the studies that we've done in regards to sunscreen use has been to a certain thickness, so 2 millimeters per centimeter. And that thickness is not really achieved by most people actually. So often what is actually recommended is to put sunscreen on, let it absorb, and then reapply a few minutes later. And then once it's on to the adequate thickness, we recommend applying every 2 hours throughout the day. Recommendations for sunscreen use has varied a lot based on location, where in the world you're living. In Australia, because of the high UV index here, we recommend at least SPF 30 or higher. Anything lower than that is not giving enough protection. In regards to applying sunscreen during winter as well, it varies a lot depending on what location you're in. Here in Queensland, we're still having high enough UV index even during summer that it's over the UV index of 3. So we would still recommend sunscreen use even through winter in Queensland. In some states like Victoria, for example, where they're having lower UV index during winter, it may not be as essential, but in Queensland we have to do it all year round. The studies so far have shown whilst it has reduced the risk of skin cancer, hasn't shown any decrease in vitamin D uptake despite using daily sunscreen. So that the evidence has not been suggestive of that at this stage. It's definitely never too late to start using sunscreen because the UV damage that we get from the sun is cumulative over time. So it adds up over time and the risk goes up with age. So there's no downside to starting sunscreen late. If anything, it slows the progression of these lesions turning into skin cancers.